So good afternoon, everyone, and welcome to our weekly briefing. We'll start off this afternoon with an update to our numbers. First, since last week, 1,271 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 236 new cases per day, which is the lowest we've seen since mid-September. This wave is far from over, but things are trending in a good direction. About 3% of test results we're receiving are positive, which is about where we've been since late September. And no big round numbers to report this week, but more than 86% of Philadelphia adults have received at least one dose of vaccine. More than 70% are fully vaccinated. And 80% of Philadelphians aged 12 and up have gotten at least one dose of COVID vaccine. More than 65% of this eligible group is now fully vaccinated. The number of Philadelphians who've received a booster dose continues to jump up. This week, I can report that more than 24,000 Philadelphians have received a third dose in total, about 8,000 more than last week. And since we're talking about booster doses, I wanted to talk for a minute about who should get a booster dose, what that looks like on the ground here in Philly, and what's next. So first, remember, anyone who got their second dose of Pfizer vaccine more than 6 months ago and is a resident in a long-term care setting or is higher risk because of their age, any medical conditions they might have, or the type of job that they have, should seriously consider getting a booster dose. Booster doses are available today anywhere they have Pfizer vaccine. Check vaccines.gov for locations. And there is plenty of vaccine available now. Finally, later this week, the FDA will begin meeting to see about recommending booster doses for people who originally got Moderna or Johnson & Johnson. If you remember from before, the FDA has external experts who discuss the vaccine first and then considers their recommendation and makes an official FDA ruling. After the FDA rules, the CDC's panel of external experts reviews the science, and then the CDC will make an official recommendation. Once that happens, we would be able to administer booster doses of Moderna and J&J vaccine here in Philadelphia. It's not just a question of whether or not Moderna or Johnson & Johnson can be approved for booster doses. The experts are also looking at who would benefit from a booster dose, at data on the most effective timing, and at the impact of getting a different vaccine from the one you got the first time. In other words, mixing and matching. While booster doses are important, they're not nearly as important as making sure that everyone who hasn't yet been vaccinated gets their shots. And Philadelphia has an important deadline coming up on Friday. All hospital and long-term care facility staff and student staff and faculty at higher education institutions need to have their first dose or an exemption by this Friday. The vast majority of people in these settings have been vaccinated, so thank you to each and every one of you. You know that getting vaccinated isn't about making a deadline, it's about saving the lives of the people around you. In high-risk healthcare settings, like hospitals and nursing homes, it really can be a matter of life or death. And given that in these settings, a healthcare worker's most important job is to keep people alive, being vaccinated during a pandemic is the lowest bar to clear. I've said it before, if you're not willing to do what it takes to protect patients, maybe healthcare isn't the job for you. I am confident that with 2 full days remaining before the deadline, and after nearly 2 months of having this mandate in place, those who are really dedicated to protecting those around them will find a clinic or a pharmacy and will get vaccinated. As we've seen at every step during this pandemic, Philadelphians have stepped up and done what needs to be done. That's why I'm confident we'll continue to see our healthcare workers and folks in higher education get vaccinated ahead of the deadline. I've been asked to allow for another extension for this mandate. But at some point, we have to take a firm stance and say that protecting the lives of people who are most vulnerable is of paramount importance. Furthermore, we're not the only people with an upcoming mandate. The federal government is expected to publish detailed rules on a vaccine mandate later this month that will apply to all healthcare settings that receive Medicaid and Medicare funds and will be effective immediately. According to President Biden's announcement, there will be no testing option for healthcare workers. They will be required to be vaccinated. Delaying our mandate won't change the fact that people still need to be vaccinated. It will just further expose vulnerable people to a killer virus needlessly. With more than 1,200 deaths in Philadelphia long-term care facilities due to COVID-19, more than 1/3 of deaths due to this pandemic in our city, this cannot be optional. Get vaccinated today. Save a life, be a hero. There are plenty of vaccine clinics and pharmacies with vaccine just waiting for you. Visit phila.gov/vaccine or vaccines.gov to find the closest. To wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Thank you.